that I'll end, and if there are any questions or any comments you would like to make, I will be very happy to answer.
So,
Yes.
sir, I was reading a fact somewhere that a diabetic female is more prone to heart disease than a male counterpart. But on the contrary part, a male has a more severe chronic than a female. So why is it just the opposite than a person has diabetes?
No, I don't think that's true. See, a male has a higher risk of heart disease compared to a premenopausal female, whether the person is diabetic or non-diabetic. If a person becomes diabetic, he has a very high risk of developing heart disease compared to a person who is non-diabetic. In fact, studies have shown that if you develop diabetes, your risk of diabetes but no heart disease, your risk of getting a heart attack is same as in a person who has heart disease but no prior heart attack. So diabetes is actually considered as a risk equivalent for coronary artery disease. But the fact that diabetic males are at a lesser risk than diabetic females is not true. Yeah.
Since one is advised to take a good diet, so how is diet related to preventing heart diseases?
Yeah, as I said, good diet means that it should be a balanced diet. Balanced means it should be a good proportion of carbohydrate, proteins and fats, and include minerals and vitamins. Now, one should have a low-fat diet, and a healthy diet should have good proportion of carbohydrates and proteins, and at least 2 to 3 servings of fruits and vegetables in a day. So that should be the general dictum. So how one can have it, just the normal meal that we have is a good diet, provided it has less of fried stuff, it does not has the junk food, and the most important culprits for us are the snacks that we have in the evening. Once you reach your home, if you have already had your lunch, you feel quite hungry, and whatever you find, namkeens and all, you try to grab them and have them, and those are actually the culprits because they are all fried stuff and they cause increase in weight and they are harmful.
So even if we just eat low fats, it won't contribute to the plague to the arteries?
Yeah, that's a very important question. Now, there is a fad going on that low fat ice cream, low fat sweets. So you have to understand that it is not only the fats, it's also sugars which are harmful. So if you have low fat ice cream, it may be having a low fat, but it has a lot of sugars. Now sugars lead to development of cholesterol and fats in the body. So even if it is low fat ice cream, it doesn't mean it is healthy because it has sugar. Similarly, low sugar sweets have a lot of fats, so both are bad.
Sir, I have heard a lot about some good cholesterol and some bad cholesterol which are referred to as HDL or LDL. So means how do the eating effects, the things we eat, affect the HDL and LDL in our body?
Yeah. So the cholesterol is actually composed of a lot of fractions which are based on the density of the proteins. So we have low density lipoprotein, high density lipoprotein, and very low density lipoprotein. Now low density lipoprotein are the bad cholesterols and high density lipoprotein are good cholesterol. So the only way one can increase our good cholesterol or HDL is by exercise. There is no other way. The diet have a little effect on increasing the HDL, but a high fat diet will definitely reduce the HDL also. On the other hand, LDL can be lowered by a lot of means, including low fat diet, low cholesterol diet, and regular exercise. And then there are certain drugs in patients who have high cholesterol, which are known as statins, which can actually reduce the LDL. So LDL can be reduced by healthy diet, regular exercise, and certain drugs, whereas HDL, which should be increased, can only be increased by regular exercise.
So, are there any other reasons for higher cholesterol apart from what we eat?
Yeah, so there are not only the dietary things, then there is lack of exercise and hereditary factors are also very important. Third, lack of physical exercise and sedentary lifestyle. Hereditary things are in fact important in certain persons where the cholesterol levels may be very dangerously high. And though the patient may be having a very healthy diet and doing regular exercise, they will still remain very high, and then they need to be treated with drugs. So it is very important to check one's cholesterol levels and its subfractions once you reach an adulthood, say around 21 years of age, and then once you start checking it, one should do it every 2 to 3 years, and maybe more frequently if it is high.
So can't we cure the coronary disease?
Yeah, so as I said, curing is not possible. Curing means totally taking care of the disease and then the patient is totally cured of it. So what we do is all what we call as palliation. That is, we reduce the symptoms of heart disease. We try to limit its further progression and prevent the development of heart attack and what we call as heart failure. But it is not possible to cure it. But one can limit it to a large extent by all these means: lifestyle modification, drugs, and interventional techniques like angioplasty or bypass surgery. And person can live a very healthy lifestyle after all these things. But technically speaking, it will not be totally cured.
Sir,
Yeah.
can't surgery remove the blockage of the heart?
Yeah, in surgery we don't remove the blockage, but we bypass it. Meaning that if you have a pipe where there is a obstruction in between, we can add another pipe which will bypass that obstruction. So that's the principle of doing a coronary artery bypass graft surgery.